In our last video, we uncovered the hidden reason why so many women struggle with chronic yeast infections and why antifungal treatments often fail. Today, we're diving into bacterial vaginosis, BV, and recurrent urinary tract infections, two more incredibly common conditions that often come back again and again. But what if the cause of these recurring infections isn't where we've been told to look? Hi, I'm Dr. George Springer, author of The Gut Connection, and welcome back to our channel where we explore how your gut health impacts just about everything, including your most intimate symptoms. Let's start with BV, one of the most common gynecologic infections affecting nearly 1 in 3 women in the U.S. You may have BV and not even know it, but when symptoms do show up, they often include a thin white or gray vaginal discharge, a strong fishy odor, vaginal irritation or itching. BV isn't technically an STD, but it is more common in women who are sexually active, especially with new or multiple partners. It can also be triggered by douching, hormonal changes like pregnancy or menopause, antibiotic or contraceptive use, a weakened immune system. So, what is the conventional treatment? Antibiotics like metronidazole or clindamycin, either as pills or vaginal gels. But here's the catch. The symptoms may go away temporarily, only to return weeks or months later. Why? Because once again, the real cause hasn't been addressed. And I'll share more about that in just a minute. Now let's talk about urinary tract infections, the most common bacterial infection in women. Up to 60% of women will experience at least one UTI in their lifetime. And of those, 50% will have repeat infections. Typical symptoms include a burning feeling while urinating, urgency to pee, even when little comes out, cloudy or blood-tinged urine, pelvic pain, or pressure. In rare cases, a UTI can progress to a kidney infection or even urosepsis, a life-threatening bloodstream infection. That's why recurrent UTIs shouldn't be ignored. Antibiotics remain the go-to treatment, and sometimes women are even placed on long-term, low-dose antibiotics for prevention. But research is now confirming what I've seen in clinical practice for years. Antibiotics may actually make recurrence more likely by disrupting the microbiome. What do BV and UTIs have in common? Both involve microbial overgrowth. Both are treated with antibiotics, and both often return even after treatment. Just like chronic yeast infections, the conventional focus is on eradicating the microbe, but not on why the imbalance is happening in the first place. In part 3 of this series, we're going to look at the deeper connection between all three conditions, BV, UTIs, and yeast infections, and what they have in common that no one is talking about, the gut. If you've ever wondered why these infections keep coming back, the answer is closer than you think. In our next video, we'll uncover the root cause behind all of them, and why the real solution starts in your digestive system. Be sure to like, subscribe, and hit the bell so you don't miss part 3. And if you've struggled with BV or UTIs, drop a comment below. Let's open up the conversation and help each other heal. Thanks for watching, and I'll see you in the next video.